Hello, today we're going to talk about schizophrenia. Listen to this account given by a man named Stuart who experienced schizophrenia. Voices like the roar of a crowd came. I felt like Jesus. I was being crucified. It was dark. I just continued to huddle under the blanket, feeling weak, laid bare and defenseless. In a cruel world I could no longer understand. Schizophrenia is a psychotic disorder, and as you may know, psychotic disorders are ones in which the person has lost contact with reality. Schizophrenia is characterized by delusions, which are beliefs that have no basis in reality, and hallucinations, perceptions that have no basis in reality, where the person may see things or hear things that aren't there. And they may also demonstrate inappropriate emotional expression in different ways. When individuals deal with schizophrenia, they can have both positive and negative symptoms. It may seem odd to use the word positive to refer to a symptom of a severe disorder like schizophrenia, but positive symptoms are pathological excesses in behavior, whereas negative symptoms are pathological deficits in behavior. A pathological excess would be an auditory hallucination. We all perceive things that are actually there in our environment. You hear me talking to you right now. But in the case of schizophrenia, the person hears voices when there is no one talking to them. And pathological deficits that you see in negative symptoms involve the absence of something that is normally present. For example, people with schizophrenia, oftentimes they uh, lack the ability to engage in conversation with people. You ask them questions, and if they respond at all, it might just be with a 1 or 2 word answer. They may also lack appropriate emotional expression, where they either seem flat emotionally or they uh, express inappropriate emotions, say laughing when talking about something that other people would find really sad. They may also lack motivation, where it's difficult for them to engage in goal-directed behavior. These are just a few examples of possible negative symptoms that a person might experience. So symptoms of schizophrenia include disturbed perceptions and beliefs, disorganized speech, and diminished and inappropriate emotions and actions. Sometimes when schizophrenic people experience delusions, they are delusions of persecution where they believe somebody's out to harm them or kill them. Other times they may experience delusions of grandeur where they believe that they have special powers or they are a famous person. Some people, for example, believe they are Jesus. Schizophrenic people, in the context of their delusional thinking, oftentimes demonstrate paranoid thinking. And by paranoid here, we mean that kind of thinking where the person does not feel safe and believes that somebody is trying to harm them or kill them. Here we see a work of art created by a schizophrenic individual. Schizophrenic people also have disorganized speech. Their speech can seem all jumbled up. It doesn't seem to be logically organized. Their ideas don't seem to be connected in a logical way, and they may have very unusual or even bizarre content associated with their speech. Here's an example. This schizophrenic young woman said the following: "This morning when I was at Hillside Hospital, I was making a movie. I was surrounded by movie stars. I'm Mary Poppins. Is this room painted blue to get me upset? My grandmother died 4 weeks after my 18th birthday." All of this she said at one time. Schizophrenic people may also demonstrate what's called word salad, where it just seems like their words are all jumbled up. Like you might put the ingredients in a tossed salad and toss it all together. This is how their thoughts seem to be. A young man who is schizophrenic said he begged for, quote, "a little more allegro in the treatment," unquote, and suggested that, quote, "liberationary movement with a view to the widening of the horizon," unquote, will, quote, "ergo extort some wit in lectures," unquote. Sometimes schizophrenic people show a flattening of their affect where they just don't show much emotional expression at all. They oftentimes have impaired theory of mind where it's hard for them to understand that other people have thoughts and intentions different from their own. And it's hard for them to understand facial expressions like you or I could. At times they also show inappropriate motor behaviors where they may become excessively agitated or perhaps even immobile and mute and sit in one posture for a long time without saying anything. One way that schizophrenia has been characterized in the past has been to consider whether it is acute or chronic. Acute schizophrenia has a more sudden onset. It can begin at any age and tends to occur in response to something traumatic that happens in the person's life. Whereas chronic schizophrenia, those symptoms tend to appear earlier in life, just the early onset of symptoms around late adolescence or early adulthood, and to be more persistent throughout life and to get worse uh, over time. So people with acute schizophrenia have a better prognosis than those with chronic schizophrenia. Also, people with positive symptoms, primarily of schizophrenia, have a better prognosis than those with negative symptoms. Some people believe that may be because positive symptoms may be associated more with neurotransmitter imbalances that can be corrected, at least in part, by the use of medication, whereas negative symptoms of schizophrenia may be more the result of structural abnormalities in the brain. Schizophrenia is one of the disorders that seems to be highly genetically influenced. If you are schizophrenic and you have an identical twin, there's almost a 50% likelihood that your identical twin will also be schizophrenic. Whereas if your twin is a fraternal twin, the likelihood is much lower. And in the graph on this slide, we can see differences in risk for twins of schizophrenia. in different countries based on whether or not they are identical twins or fraternal twins, and you can see the risk is much higher for identical twins. There are various explanations that have been offered for explaining the cause or causes of schizophrenia. Probably the most popular and widely held theory is the dopamine theory of schizophrenia. And here the idea is that with people who are schizophrenic, there's an overabundance of dopamine receptor sites in their brain on neurons that respond to dopamine, and therefore those neurons are over responding to dopamine, and that might have something to do with causing symptoms of schizophrenia, especially positive symptoms of schizophrenia. Other possible biological explanations that have been looked at include uh, structural abnormalities and decreased activity in different areas of the brain and loss of brain tissue. There are various risk factors that are associated with schizophrenia, uh, being born with low birth weight, mother's diabetes, father's older age, lack of oxygen during delivery, famine, and also mid-pregnancy viral infection. One of the popular theories of schizophrenia is that some people are born with a genetic predisposition to schizophrenia, and depending upon what happens in their life, their schizophrenic symptoms will either more or less uh, be likely to be expressed. Going back to the idea of epigenetics we talked about before, that there seems to be an interaction between the biological predisposition for schizophrenia and the extent to which the person is likely to actually have symptoms of schizophrenia. Thinking about biological explanations, here we see two identical twins, one with schizophrenia and one without, and you'll notice that the ventricles are enlarged in the individual with schizophrenia, suggesting damage and death to neurons in that part of the brain, resulting in a larger space there uh, where the ventricle is located. In completing this section on schizophrenia, let's take a look at a couple of retrieve and review questions. A person with schizophrenia who has blank symptoms may have an expressionless face and toneless voice. Positive or negative? You're right, it's negative. What factors contribute to the onset and development of schizophrenia? Give that some thought and see what answer you can come up with. Now, this completes our section on schizophrenia, and schizophrenia is the last disorder we will be discussing. I'll look forward to talking with you again soon about therapy. Peace be with you.